Nazim Khan is the executive chef of nutrition and dining services at Bryan Health and an award-winning professional executive chef, CEC, WCEC, WCMC. Nazim began his career as a sushi chef, there we go, in 1997. He has worked at the New York Marriott Marquis, Long Island Marriott, and even as executive sous chef at the New York Battery Park Ritz-Carlton, as well as an educator and chef for Virginia Tech. Today, he serves as executive chef for Bryan Health, where he has developed multiple popular plant-based protein dishes for both retail and patient meal services. In 2016, Nazim was named one of the United Fresh Produce Excellence in Food Service Award winners. In 2019, Chef Khan achieved World Chef's Certified Master Chef status and was named to the Chef's Watch list by Food Management magazine. In his free time, you can find him serving local firefighter dinners and continuing tribute to those who died on 9/11. Chef Khan is currently sharing his passion for healthy, locally sourced food at multiple Lincoln farmers markets and doing culinary demos, helping people eat to maintain health and helping those struggling with illness to nourish body and spirit. And last but not least, Chef Khan is a proud member of the Nebraska Food Council alongside some of those listening today. So Chef Khan, I can see your screen just fine. It's all looking good, so you are good to go.
All right. You already talked a lot of things about me already. I'm a World Chef Certified Master Chef, but I'm a very humble chef who wants to know where the food comes from. So this is very important to me. So when I start my journey in New York City under Chef George McNeil, also US Certified Master Chef. So chef always taught us, make sure your guests get the best ingredients possible. So it could be meat, fish, veggies, everything. So that time, a long time ago, 15, 20 years ago, there is a program came on, serve local. So eat local, what you have, you can resource 50-mile radius in a Hilton and Marriott Corporation. So I was big on that to learn my produce, where it comes from, and how we can put a twist into flavor profile, change it. Zucchini, you can take one zucchini in 10,000 different ways. You're serving as a chef or talented chef to create your spin. That's not farmer's job. Farmer's job to create you a wonderful veggies they will produce for you, and as a chef you will do the spin. Before so I've already say that I'm a humble chef, but these days, if you ask your kid, some kids even don't know where their veggies or rice comes from. They say it all comes from Walmart. So we need to make sure that we're educating as a parents, as a teacher, as a husband, wife. We all should be educating our kids that where food comes from. Take them to the farm, take them to understand, how the food grows and all those things. Before I start my slideshow, I got a few slideshow to share with you guys. But before I start that, but I would like to thank each and every farmers who are supporting Bryan Health and also supporting our local community. I do farmers market demo, teaching others how to cook and how to do a good food at home. I wanted to show, probably my camera can see, is a Shadowbrook Farm flyers that is laminated. I have, Hillside Orchard apple that I used to serve. Then, Hisses Farm cheddar cheese, everybody loves it. It's my favorite. Old Farm, then, Davy Road Ranch, local grown mushroom like Nebraska mushroom, Delish Farm. I love their veggies, so I want to thank them. Robinette, one of my favorites. We do all our microgreen. They're packed with macronutrients that goes into our lettuce mix every day. So we have a standard order with Robinette. Make sure they have year around. I get the microgreen from them, so I can serve that mixing with the other lettuce, so everybody can enjoy a little bit local. The Squeaky Greens is another one. Then Abbey Vegetables is another one. Then Pecoric Farms, all the potatoes. I love Pecoric Farm. And then also Rizzo City, one of my favorite too. So there's lots of farmers out there, and they have really good product and produce that chef can put their twist into that and serve our guests and our families. So then I wanted to talk about one more things that what Bryan Health actually did. I'm going to show a few slideshows later on, but in 2018 we started doing the journey, but I cannot have an account set up with each vendor, each farmers. So here's a loan tree kicks in into that. They kind of buy all the produce from locally, and I directly buy from Lone Tree. So in 2018, I spent $10,000 when I started using local veggies. Then 2019 is went up to $16,000. 2020 we did $16,000 also. 2021 we deep to buying local because we did not allow to guests come to visit their friends family in the hospital. So because of COVID, so we are under in that issue. So we did not sell that much, but we're going back again. So I would love to sell more of that, and chef should be in the front selling all the veggies for our farmers. So says enough. And then okay, now how I change? Oh, here you go. Bryan Medical Center, part of we have 6,300 employee health system. So we are growing bigger and bigger. We just bought Culinary Medical Center, so it is going huge. And Bryan Medical Center, 2 facilities. We have 600 bed, Bryan East and West. You guys already know. NDS is a 3 production area, Women's and Children Towers, and also we have East Campus and West Campus, and also we have a 4 retail service and 2 cafeteria, 2 coffee bar located. We used to serve Starbucks coffees, but then we did Bryan Bean. That is also like our one of our local coffee that we are working with, and is going really well. Preference to the locally sourced food. Locally sourced, support local economy. Of course, that means every chefs need to make sure that we are supporting local farmers. We know the people producing the food. We know the quality is high, and they know we want the quality high. Of course, as a chef, I always demand the best quality of the food for my patients, family, and all for my employee. So it is very important for me. So I wanted to touch the produce. I wanted to feel it, and I wanted to see, how great they are. Of course, when California producing all the produce and they're traveling through California to Nebraska, you cannot get the freshest ingredients. They all have packed with some sort of preservative to make sure that it doesn't go spoil or anything during the transition period. But if we can get it right from the field and serve it to our patients and family that full with macronutrients, that is very important to us. Featuring locally roasted coffees, Arbor Day in our cafeteria, the meal, Cultiva, Mark Ferry coffee, and Bryan Beans. We sell that. Our nurses, families, they all love it. Then you already see that pictures, and I did not bite that green pepper, like Iron Chef do, but these are all, from different vendor. Behind me, you can look at it. There is some stuffed peppers. That's what actually I did one time, and it's a great product. We just groundbreak our cancer center at East Campus. That was a fundraising event for huge event. So I kind of I showcase our Shadowbrook Farm, Dutch Girl, creameries, all the cheeses. Everybody loved it, and I love cheeses. And I'm telling you, they have the best cheese in the country. So then you can see we would do like local, like Crow beef. They do all the steak and all the other things, but they have tons of ground beef left over. So I said, okay, we can buy that. We can make hamburgers. We can do all the stuffed veggies and all other things. We can divert them. So we buy their bulk ground beef, and also we sell that to our nurses and our employees too, so they can, before they goes home, they can do our grocery from our nutrition and dining service. Then you can see I'm in a Robinette farm, their greenhouse plant they have. This is spinach. Then here's the microgreen that they do year around for me. Bryan Medical Center philosophy: food as a medicine. So I mean, and I already say 3-4 times macronutrients. I don't know. It is in my head. Probably that is a selling point for me. But just think about it. Patients, your care. If we can teach our patients or our friends, our families, our entire Nebraska, what is good for you, what you're putting into your body that actually heal you and do the right things that will take you to the longer run, less cancer, less all other diseases. That's a huge factor. We can cost down our health system or healthcare every year expenses that we do. So it is important for us. We need to understand that. We need to understand what kind of produce is helping you to get more macronutrients that you can survive and get better and stay healthy rest of your life. Many patients suffer from malnutrition or poor nutrition. For food selections and quality matters, of course. The better that they eat, calorie, nutrients, complex, the better their healing process. We also feed our clinician and support staff in our medical center. Healthy food is a medicine for them as well. It is the way of staff to enjoy good food and maybe one of the few breaks they have on their shift. You already know what I'm trying to say in here. Our nurses, they do 12-hour shift every hospital. So, they have very limited time to go home and cook a good meal. They eat in our cafeteria. So if we inject too much fried and all those things, fried food, that's really not healthy. So we support a lot of healthy diets along with some comfort food, but we try to do the best food out there with best quality, so that way they can enjoy a nutritious meal that will help them down the road. Then background of healthy choice promotion on NDS 2019, we already promotion on the salad and fruit bar. Pretty much every hospital and different dining places, they have a salad bar. But what is different there than ours? Ours one has the Robinette Farm macronutrient, all the microgreen mixed with our salad bar. We have a fresh veggies, we have a jicama, we have hearts of palm, we have different type of fruits in our salad bar, low sodium protein in our salad bar. We have tofu, we have lentil, we have beans. So that kind of makes it more healthier. You got more varieties people can pick from, and that is really help them for their daily choice. 2019 we started Noodle Bowl, and Noodle Bowl, the stock, we do everything from scratch, and also we have lots of protein. Same thing with the lotus roots to jicamas to other spinach, bok choy, all those things that we have that actually full with nutrients too, and also tasty. So our doctors, they actually ask us to do like more heart healthy food, and we have that in a plan. We have that in our menu choices too. 2022, we increase our plant-based protein item, designed to mimic animal protein. So there's like Beyond Burger. Everybody knows, everybody's selling Beyond Burger. So that we have, but all other plant, what is into that Beyond Burger, we have it right here, or we have it in the country. So I really not big fan of a Beyond Burger protein because that has lots of sodium and stuff. But we have lentil, we have chickpeas, we have all other beans that I can do locally resourced. I used to get dry bean from Lone Tree, but past years, is that I'm still on?
We can still hear you, Chef. We just can't see you.
Oh, okay. So what happened to the camera? Okay, I don't know. Probably technical difficulties. Start my video. Here you go.
There you go.
Okay. All right. So sorry about that. So we have like 5 days plant-based protein stations. So we are the leading in the country as our plant-based protein option. I'll show you in a slideshow to confirm that. But we make our own falafel from scratch. So we soak the chickpeas, we grind the chickpeas, we make our falafel on Monday, we make our hummus, we make our lentil taco tostadas. All those things can mimic the meat, but at the same time packed with the protein, so that actually healthier living choice for you. So if we go, background of healthy choices promotion, we have done so many other things, and also our sales increase. So we thought that, Nebraska is only meats and potato, but people like healthy stuff too. So that actually increased our sales volume up. Um, Background, healthy choice of promotion of NDS 2021, we did a special salad, 10-layer tacos, like Caesar Wednesday is a killer, 200 salad each campus. We do hand toss salad for them. Very popular retail customers, smoked meat Monday with the less carbs. So our carb, we use like our cauliflower rice and all other less carbohydrate stuff. I mean, combined with your local, we do our in-house flavor profile smoked meat. So that goes with that. So people like that. Omelet stations, that is always a good one. And here's some pictures, choosing healthy flavors. So from noodle bowls, we have varieties of stuff. We got local greens. Then here's a tofu dish. People can take Thai green curry sauce, Thai red curry sauce. We have a mushroom broth, and also we have our beef broth. Then here's our taco tostadas that I talked about it, but that plant-based is fully lentil, and it good Hispanic flair to it. And it was one of the highlighted stuff. They promote that in the Food Management magazine nationwide. Here's this pictures is really one of my favorites. So this is our 5 choice of plant-based menu options for they come in, they buy it, and this is we have a station for that. But you see that Bryan that I write, that Bryan is all with lentil, bean, a little bit of orzo. Orzo was not local, but lentil and bean was the local, and all this green behind it with the tomatoes to everything, those are all locally resourced beans. So we did that pictures, and I'm really proud of that. I really enjoy that pictures when I see it. But here's some of our, here's a falafel that I talked to you guys. It's a fresh you can get. This is our vegetarian gluten-free pasta also we sell. This is a local zucchini stuffed with plant-based protein in it with the marinara sauce. That is, I do special sometimes that goes very well. 2020, it was one of the highest selling one, but 2021 and up to these positions, we're not buying that much locally, but I'm back on track again. Food work as a medicine, I talked about several times. So here's some of the thank you notes from our nurses. Here's handwritten notes. Thank you, chef. We have tons of those thank you notes from our nurses and families. Lots of recognitions throughout from our doctors, throughout from our patients. They're all local Nebraska, and they're saying that, chef, all after taking all the medications and jacked up with all those injections and everything, but they love the food. That's a great accomplishment for a chef. When you have so much medication in your body, but you have a taste to enjoy a meal, that is a huge recognition for us. And we received the honorary award in Asian Curry Award in United Kingdom. I went to London to receive that. And several of like menus of changes nationally, internationally. I had to speak for several occasions. Executive chef asked also represent Bryan Health in the Culinary Innovation Hospital Service during national conference held in Food Management magazine. You already see on Google, you can see chef to watch list. I'm one of them. So it is accomplished that I get because of my local growers. So all the chefs out there, they can actually get recognized and do the right things for our local farmers. How we can be more innovative, how we can do year-round greenhouse, how we can bring the cost down, how we can utilize the product 100%. That is very important. Locally, products are not cheap, So compared to your California or other places or other countries it's come from. But as a chef, if you know your yield and if you can properly use 100% of that, I mean, I'm sure that you can figure out the cost savings from one side to another. So I really don't think cost is a big deal. But of course, local farmers need to think about it. Like, hey, you know what? Probably will cost a little bit higher, but we will make sure that they can afford it. Restaurant can afford it, hotel can afford it, and Bryan Health can afford it. So that is very important. So this is one of the things I was talking about, menus of change. Who does that menus of change? So this is a Harvard University, TA's Chan, and also Culinary Institute of America. It's a joint venture. They do menus of change every year. So last year was their topics. Every year they have a different topics to talk about it. So last year topics was all about plant-based. So when they do their research and homework, they find out Bryan Health is the #1 in the country that who is serving 5 days plant-based menu to their patients service and their family and their employee. So if you look at it, I will go into the second slide. So in the magazine, you can see the plan forward healthcare operations to watch. So Bryan Health is #1. And who is Bryan Health and where it's located? I get that question a lot. I said we are from Lincoln, Nebraska, middle of America. So Bryan Health is #1. So that when people think about like where is Bryan Health, then people think about it is Nebraska. So I did my part to bring Bryan Health to the national recognition. So all the farmers, all UNL, everyone, if they do their part and put the chefs in the front to talk about it, I think we can accomplish the goal together. How we can eat our local veggies throughout the year. So that is very important for us that we are self-dependent with our local produce. So we can energize them. We can get whatever funding they need, and also we can buy and engage with them. So you can see after Bryan Health, all the other hospital name, Ohio Living, City Hope, and la. And there was like say John Hopkins, bottom of the list, and also St. Jude's Children's Hospital, but I could not cut and paste. Yeah, I think I did a good job, but that's all I can do. Okay, pandemic reliefs and support for Bryan staff. So what we have done throughout the pandemic, as a chef, and also our nutrition and health dining service director, Mike Dixon, we tag team together. We talk about, say, chef, what we can do. Our CEOs, Russ, say, chef, everybody's stress level is very high. So how we can support them. So as a supporting unit, nutrition and dining service, we start doing groceries to go. So nurses can put their groceries list online. And then on their way home, when their shift is over, we have the bag ready to go to take the groceries home. Then meal to go. So we try to do like a hot meal to go for nurses, doctors, and employees. So they can also do online meal to go, select all the idea of what food they wanted to have, and we can have that ready in designated area. So they pay and they take it at home. Pieces to go. We did like probably I said at least 11 to 12,000 pizza for 2020 and 2021. More, we're gonna do it soon. Again, we have some issues, camera issues, I guess. Hello, where are we?
Okay. We can hear you. It's just your
camera.
Oh,
okay.
There you go.
Here I am. Okay. So and then distributed 10,000 pizzas. So it's already says that in here, plus more on the pipeline. Family style meal units for the managers. We did for all the nurses, managers. Heart to home family style meal for 800 providers that is still doing it. Today is their last day. So that was 2 months, last December to February. So India's created a brand. Ford truck is offering novelty, fun food stuff, stressed demand of pandemic. So in 2021, I was asking for a food truck to take it to different campus and cook food for them. but we did not have the budget for it. So what I did, I created a fake food truck banner, and then from the window, I just start behind from that. And it is a national news now. So Food Service Director magazine already highlighted 3 times, and most reading article for Food Service Director magazine 2021 was this food truck. So it just as a chef, and from everyone's standpoint, we have to come out from our shell. We have to think outside of the box, how we can do more to engage everyone. So it is going great. Next month, this month is my food truck is New Orleans Mardi Gras theme. So of course, you guys already familiar with that food. So everybody's excited. In-house. And then, top 10 healthcare dining stories of 2021. It is also Food Service Director magazine, and they highlighted my food truck is right there. You can see it looks like a truck, but it is a banner. It is a banner holding with the easel, and behind that I'm standing, and behind that there's a shelving unit. I put pots and pan hanging, so it's look like a truck. So 4 story was highlighted. So there's another story that I wanted to add on. Then probably almost end of my talking. I hope I'm not making anyone bored out there, but this is a good story to share. So you can see Tom Colicchio in this picture. So when I was a young chef in New York Marriott Marquis, that is on 2001 or 2002. I just become a sous chef, from a cook to a sous chef. Then Chef George McNeil, my guru, so he handed me a book and say that, Nazim, his name is Tom Colicchio, and he's a rising star of New York City, and you should follow him. He's a great guy, and read this book. That book is named called Tom Think Like a Chef. So I read that book. So that was long time ago. So I never knew that one day I will be in the magazine cover pictures with that guy into the same picture. So that was like really intense for me. I said, oh my God, that's really neat. But I wanted to share that story to others. So that means don't look for your recognition all the time. So when you're in a leadership role, and when you are somebody already, you just continue, do your work, continue hard work, and dedicate yourself towards a right directions and right goal, and things will fall onto you automatically. Look, I'm speaking as a keynote speaker. I did not born and raised in America. I born and raised in Bangladesh. When I came to America, I was 21 years old, but I was always focused towards my goal, and I always wanted to do the right things from a managerial standpoint to what is good for others. So this is the learning moment for everybody, that if we support each other, if we do the right thing, I think we are all is into the right direction. So and I wanted to make sure that we understand that how important it is to eat healthy and live longer. So if we are not healthy, if we're not putting right things in our body, if we're sick, we are not into the right mental stage. So we need to make sure that we need to eat healthy and help others to eat healthy, and talk about the good food and the quality of the food. Next slide. Here's my, I had a slide, the big one, so you can see it already. This is also the magazine article. I crop it. Then next one, next one is a question. Wow, I'm done. Wow. So I think I'm right on track. I have plenty time. So you shoot me a question. If I have answer, I'll give it to you. Otherwise, I'll park, and then later on I'll come back to it.
Yeah, thank you, Chef Khan. You had some really great visuals. I will be, just for everyone's information, I'll be the moderator for this next. We've got a nice 20 minutes for question and answer, which is great because we can get pretty conversational here. I'm going to go back into the chat real quick and just read from Diane. She says, Nazim is a great advocate, and his system should be a paradigm for other institutional kitchens across Nebraska. And then she posed these questions, I think, to the group, but I wanted to ask you, Chef Khan, do you know of others who are following your lead in Nebraska, for example, schools, nursing homes, prisons, etc.?
Okay, yeah, that's a great question. Actually, my time get completely occupied at work because since, I don't do 8-hour shift because I always wanted to do more. So I'm always here, try to do the better, educate my crews and everything. So when I go home, I really don't get time, but summertime I do farmers market demo and all other things. But this one thing, like AHF, American Healthcare Association. So when I went to their convention last year, that time, they had somebody from Omaha, also Omaha Hospital, also part of that AHF. So they went there, we talked about local foods, helping locals. So they really praised me, but I'm not sure that they're really doing it or not. And all other places, they should be doing it, but probably we're not marketing right. Probably we're not talking more. And probably if you need me as a volunteer to go and speak, and if they want to visit me, then I can show my area that what I am doing. Yeah, we can. I can help any way I can, but I'm not sure who else is. But I know Sarah Smith is doing a great job for a school system to eating healthy veggies and stuff like that. So I heard about that. So that's a great initiative. So yeah, that's all I have.
Okay. I'm going to read from the chat a couple more questions. I do have my own, so hopefully we have time for those. But Robinette Farms asks, what are the biggest challenges you run into when working with local food?
Biggest challenges. Okay, I'll tell you that I have lots of challenges. So one of them, if I said I need, when I talk to Lone Tree, okay, I'm looking for local zucchini. Okay, chef, this farmer, that farmers, they have 5 pounds of this, 2 pounds of that, 3 pounds of that. So 10 pounds, but I need 40 pounds, I need 50 pounds. And okay, if I put that into my menu, so then I need the commitment that I'm getting a 5 pound for every week for other things. That commitment I haven't get any from anybody yet. But I talked to Lone Tree about that, because when you put things into the menu, you automatically cannot just take it out. I'm talking about from local zucchini. I'm just picking up one product here, zucchini. But then next week I don't have it. Then I cannot really change the menu. Then I have to substitute the zucchini from California. So that's hurts my integrity. That I cannot do that. So that's why you see in the first, when I did my slideshow, I picked everybody's. This is a laminated one. It is not like real little page, because I post that into my cafeteria when I have the mushroom from them, when I have the veggies from Robinette Farm or Delish Farm or Pecorich Farm or cheese from Hisses Farm or from Shadowbrook Farm. So the challenges is that is need to plan and organize. Need to say, okay, each farmers, if they come to me or email me, say that, chef, we're going to provide you 5 pounds of zucchini 6 months from that date to that date. I can put that for a 6 month into the menu, and then I can use that 5 pounds of zucchini. So that planning and action, if we do it right, like I had Rizzo City, I had planned with them to get a parsley 3 pounds for each campus 2 years in a row. So they did an awesome job. So but last year I didn't actually look for that. So that is the challenge that I have. And also the price wise, of course, I know it's a local, it's going to be a little bit expensive, but try to do your best for a bigger company like Bryan or UNL. So we're buying a bulk. So small, so that probably is another issues too. But I figure out all the time.
So am I hearing you right that really the solution to those challenges is a really good working relationship and partnership with those local producers?
Absolutely, and have more meeting with chefs. Like all the farmers can come in one place and have some local chefs, me and other hospital chefs come together probably for a meeting. Just right before your harvesting season start. and right after your harvesting session. So if we do like 2 meetings, beginning and the end, then we can see what is actually looking for. And some chef will commit on the spot. Like me, if I see the agenda and everything is right, I will commit on the spot because I don't have any problem to utilize the product at Bryan Health.
Great, thank you.
You're welcome.
We have some more questions in the chat here. Steve Roth from Nebraska Department of Ag says, which markets do you do demos at, and how can we find out where and when they are?
Okay, so when Sarah Smith was the market managers for Old Cheney and also for College View, when they moved from Old Cheney to College View, on 48th Street. So I have done every year, and then pandemic hits. Even I did last year a couple of times. But Sunday, I love to be more involved in farmers market demo, but with a good positive networking attitude like that. People need to know. If I spend my time, my own time without getting paid, doing all those things, but people don't know, then I see like few people who are just roaming around in a farmer's market, then it's not I feel like my time is not vested right. But if we organize well, we drum up the beats, we wanted to talk with our entire Nebraska and do a big thing, I'm always volunteer my time to do those farmers market. But I have done only in Old Cheney and this 48th Street College Point View. I think that's this college. Yeah, College. Yeah, College. I think. I forgot the name of that. 48th
No.
Street.
Yeah, great.
Sunday farmers market.
So can you kind of tell me a little bit about what a booth looks like at, say, the Sunday farmers market?
Yeah, so it is. I have a table with the Bryan Health logo tablecloths on top. Then I have the food, and they had tent, and they had a little grill that sometimes I do grill, and I, of course, from a health service standpoint, I have to make sure bring the food cold, make it hot there, or keep it cold for 4 hours. So I use all the healthcare protocol and disposable service things that I serve as a cold and then do it. I have some. I have one more. I have a couple of pictures opened up, but I'm not sure I can show you that on a share view. Later on, I'll email you so everybody can see.
Oh, that's perfect. Yeah. Yep, we will follow up with those images. I have another question. Patricia Pinto in the chat says, as a beginning farmer finding my way, how do you connect with farmers? Being new, I am wondering how my farm can be included. Okay,
so before that, I wanted to give you one story. So when I was the executive chef for Cedar Rapids Hilton, so they do like, I think they do once a month farmers market, but it's a big one. So, and I used to do farmers market demo throughout their farmers market. So where I set up my tent, they call it chef demo tent. So when I go in there, next to that tent, there was a school professor, high school professor, psychology. So he used to bring some fresh parsley, fresh basil, and some fresh herbs, and so good. And I said, you know what? I love your parsley, basil, and all those fresh herbs. It's really good. And then he said, I said, this is what you do for a living? Then he told me, no, I'm a teacher in a high school, but when I'll retire, I will become a full-time farmer. I said, okay, I have one little task for you. You wanted to take that challenge? Then he said, well, tell me. I said, did you ever grow a microgreen? So he said, no, I never grow a microgreen. I said, for my restaurant, 351st, that a Hilton top restaurant, I said, I use microgreen every day. So 365 days, so 2 to 3 times, I'm going to require like a small container of microgreen. Can you do that? So he started doing that throughout the summer. But when winter come, he said, oh, chef, I don't think I can do that anymore. I said, well, your name is on the menu, and I'm using that microgreen, and I'm loving it. So why don't you figure it out? Do some greenhouses. Then he said, chef, I give up my 1 bedroom and start growing your microgreen inside the house. I'm not sure how the farmer's standpoint, he can do it or not, but this is the story I wanted to share. Like if you wanted to grow and do it like Rhizo City is an example. They 6-7 years ago when I started with Bryan Health, Skylar can tell you that story. Skylar and Matt just graduated from UNL and they wanted to start a farm and they asked for Bryan Health West Campus. There was a land was like abundant, so can we use to grow some produce? Then I said yes. So my vice president came to me. I said, of course, give it to them, and I will buy all their produce. So they were harvesting parsley left and right, basil on all the fresh herbs. So I support them. Now they're big now, Rhizo City Farm. So for young farmers like that, first of all, as a hospital or big organizations, we cannot just buy product from anybody we want. We wanted to make sure somebody's checking the product, make sure some rules and regulation is all maintained in a right way. So then we can make them as a vendor. But since I start working with the Lone Tree, so for that person is better to start with the Lone Tree. If Lone Tree sees everything is going great and they have the right product, so they can sell it to Lone Tree and I will buy it from Lone Tree.
Great, thank you. Quickly, is there a site or is there a way for you to share access to some of the recipes with agencies like, this is from Carrie Heaton of the Food Bank Food Bank for the Heartland. Okay,
so recipe sharing, I rather do there's lots of things involved into that. Yes, who am I sharing recipe and for what and what reason? If of course I can share some recipes, but there's before you dive into the recipe, is first thing you have to understand the product. Lots of people always, I get email left and right from nurse to everybody. Chef, I need the recipe. But I guarantee you, I give you a recipe, but this is not going to come out the way I cook. Or this is not going to come out the way how the Gordon Ramsay cook. Recipe is the same. So it's the thought process of the cooking. How you doing it? What is your ingredients? What you putting together? So if you need that advice, you just email me, talk to me directly, and I will guide you through how to build your own.
Okay, perfect. We will definitely share your contact info with folks after this is done.
Yes.
From Wally Graber, are there commitments that you and other Bryan Health leadership are planning to make for either a dollar amount or percentage for local food purchasing in 2022?
Well, dollar amount, I already talked about it, right? In the early of the meeting, like, $16,000 to $20,000 amount is pretty much just the basic that when I started with. So we can grow more. So that's not the point. But, I don't have to comment. I'm doing it. So, and my CEO is, Russ is huge on, supporting locals. My vice president, David Rees, huge on locals. My directors, Mike Dixon, is huge on locals. So we're trying to do as much as we can get local involved into our food trend, to other trend and everything.
So that actually transitions to one of the questions I had jotted down. So I was going to ask you if it was a hard sell with your bosses or the powers that be at the hospital to move more into this local direction, but it sounds like it wasn't. And if that's the case, if it was an easy sell at Bryan, in your experience, is that the case with other institutions, or is it more difficult to get people's buy-in in other areas?
Another area. So again, I don't want to blame anybody, but whoever is the chef or director is in charge of that food, everybody talks about cost cutting, labor, and all those things, but everything is a balance. How your cost probably local a little bit higher, but there's a lot of other hidden costs that you are not seeing it. So if you can manage those costs really good, then a little bit higher of the local food is not hurting you. It actually, your sell point is going up. How you're marketing your product. So when I put Robinette Farm green, I'm just saying, or Delish Farm zucchini as a local, so that is stuffed zucchini, for cafeteria, we have to keep our price down. It's just for, employee and our families benefited. So, by our local entree probably $4 or something. But if I buy that local zucchini, I put that $5.95, so $2 more. But it's not cutting it. People aren't say, oh my God, it's too expensive, I cannot buy it. They're buying it. I ran out. So that means how you twisting, how you putting in the showcase, or what is the best flavor profile you can play with. If things get bored, you get recipes, okay, only one type. Next 2-3 weeks, it becomes like blend. But if you are innovative, if you try to exercise different thought process, different style of cooking, and especially the global flair of the food. So that is important. If you just know only Italian or German food, then you are in a wrong boat, my friend, as a chef. So you need to have like expand your horizon, learn understanding different culture and ethnic food, and then twist your flavor with, and then buy local, little bit overpriced is not a problem. You can manage that. I guarantee you. If you can't, then let me know. I will show you how you can save money.
Great, thank you.
You want
Another question from Robinette Farm. How important do you think it is for producers to have food safety certification in order to work with institutions like yours?
Very important. Very important. Very important because, first of all, I work for healthcare, right? And plus I work for Hilton Marriott Corporation. So I never work for freestanding restaurants or anything. So from a corporate standpoint, it is very important that you need to have that knowledge that what you're serving. Like in the beginning, I say that I wanted to know where the food comes from. I visit Robinette Farm, indoor and outdoor, their processing plant, clean, neat. I was like really happy. That's why I showcase their produce pictures. And they knows what they're doing, right? And other places that I visit also, they knows what they're doing. So, and I wanted to visit more. I wanted to visit, other chefs should be visiting them too. But the thing is that knowledge is the power. So we need to make sure that certifications pretty much all chefs should have.
Great. We have a few more minutes, so I guess this timing has worked out perfectly. I'd kind of like to close the loop on your presentation message about Plant Forward by asking, when you're trying to sell Nebraskans in particular from the beef state on Plant Forward, how do you message it so that people understand that Plant Forward does not mean plant only, and that all of these things can fit? Yeah,
the plant forward, even cow have to eat grasses, so it's like related. Like if you do a cycle, somehow we are all connected. So we need to make sure that it's not only plant, but how you support the plant with your meat together. How you can support as a chef eating less carbohydrate to more veggies. So we can cut down carb. Actually, carb sometimes become enemy unless you are running, jogging, or doing all kinds of burning out calories. But and I'm not a dietitian, so I don't want to talk too much about it. But it is important for us. We have to eat meat. We have to eat other sorts of different type of protein, not only plant protein, but plant forward along with that beef and other protein. So we should merge.
Awesome. Thank you so much, Chef Khan. If anybody else, we have a couple minutes here. If you'd like to unmute yourself and make a comment or ask a question, you're more than welcome to. Otherwise, I would encourage you, Chef Khan, to look through the chat before you log off today, because people have been very complimentary with their comments. So definitely do that.
Yeah.
I'm going to pause for a second so that people have a chance to unmute if they want to.
Hey, Nazim, Alex, and Chloe here at Robinette. Thanks so much for all your work. You do a great job, and we need more institutional buyers who are excited about local food. So thank you.
And thank you. I mean, this summer we do like chef table in your place.
Yes. Yes. Let's do it.
Hopefully COVID will leave behind and everything goes well. So we do like nice chef table with 7-course meal with some clientele from Nebraska.
And how about farmer demo in your cafeteria someday? Get
Yeah,
us in there, talk to people and
absolutely.
share some
Yeah,
food.
we have done 2 times with Rizo City Farm, but then they said, Chef, we got so busy, I cannot do it. So they give up on me. So yes, of course I can start that again.
Yeah, let's do that. That'd be great. Thank you.
Yeah, thank you. My pleasure. Have a great day.
Good to see you.
Same here.
Awesome. Well, thank you again so much, Chef Khan. Again, don't leave until you've read the comments in the chat.
And also, I just wanted to thank another person too. I had my sticky note on it. Renee, Renee is a great. She comes to the farmers market, and also she got some small restaurants in a small town. Thank you, Renee, to recommend me also to speak about all the farmers, and I appreciate your help and support.
Yeah, you came very highly recommended, and we can all see why. Thank you for being with us today.
Yeah, thank you. It's
Yeah.
my pleasure.